Hello, I am Dr. Leena N Sreedhar. I am heading the Department of Obstetrics and Gynecology at Manipal Hospitals Dwarka, New Delhi. I have been in this department and have started this department since the time of inception of this hospital, which was in January 2018. I am an obstetrician and gynecologist, and I have been in practice for the last 28 years. I passed out from Maulana Azad Medical College in Delhi, followed by my MD from Safdarjung and my senior residency. Thereafter, I worked as a specialist all over India in the armed forces, both as a graded as well as a classified specialist. IVF is indeed a wonderful procedure, and it has brought hope to the lives of so many childless couples. When so many years back they couldn't even hope to get a baby. I think any new technology, though it's not a new technology anymore, many new procedures are being added to the conventional IVF procedures. But anything new is always viewed with a lot of suspicion, and I think people should not be wary of it and take it up timely. What I'm trying to say is, for example, if a lady has damaged tubes and she's being told that when she's in her 20s, it's always better, instead of hoping against some kind of a miracle to happen and going and keep on changing your doctors or hoping that naturally she can conceive. Instead of that, she should take a step much earlier in her life while she's younger, while she doesn't have medical problems herself, while both her husband and she are really fit to have a child. After all, it's not just about having the baby, it's rearing the baby, looking after the child. And when you're much older, it becomes all the more difficult. Most of the complications that happen with IVF pregnancies are because the mother has some inherent medical problem, or maybe the father has, the father to be has some inherent medical problem. IVF pregnancies are indeed, very precious pregnancies, and they come with a lot of difficulties. Many of them it doesn't happen in the first cycle, so they are being given a lot of medicines. However, to say that IVF pregnancies are going to be abnormal or they are going to create problems, I think that's a very wrong outlook. Obviously, the couple has had all the other options have been closed for them, and that's why they have come for it. So what I would say is that the sooner you have been told that IVF is the only option, you should opt for it instead of go on trying other methods. Go for it when you are young, because then there are least chances of having complications.
So, PCOS is one of the most common conditions among Indian women, yet the awareness about the same is lacking. So, how can someone know if they have PCOS and when to pursue treatment for this?
Okay, this question is a wonderful question, because polycystic ovaries has now become a big challenge now. In fact, in our walk-in OPD, if we take a census, almost 15 to 18% of women who are coming for general gynecology problems, it's related to polycystic ovaries. So it's become really very common nowadays. What a lady has to understand is, if she starts getting irregular periods, at any point in her life, it could be a young girl who's just about 17, 18, or it could be a married woman, or is a lady even in her late 20s. If she starts getting irregular periods, if she starts facing increased weight, or if she's got a history of having inappropriate hair, that is what we call hirsutism, acne. She goes to the skin doctor with a lot of acne. So all these women who are facing this problem, they should also show their gynecologist. They just may have polycystic ovaries. However, polycystic ovaries में ऐसे भी देखा जाता है कि some women have not really put on any weight, पतली हैं, तब भी उनको irregular periods हो रहे हैं, बाल नीचे के दाढ़ी के बाल आ रहे हैं, what we call male pattern hair distribution. Or they have falling hair as in the hair that they have on the head, and they face acne or they have some pigmentation. ऐसे में they should go and show the gynecologist. because they just might have polycystic ovaries. So any woman who has irregular periods, any woman who is putting on inappropriate weight, वजन बढ़ रहा है, और any woman who feels that hair distribution उसका कुछ abnormal सा होने लग गया, she is getting more of the male pattern hair, she should go and consult the doctor. Save the girl child. I think everybody is trying to do that. But I think as doctors, we are best equipped to. Starting with my department, for example, refusing any kind of sex determination, that's just not done in this hospital. Secondly, looking after the health of a girl. So if we have a young adolescent girl brought to us, apart from her medical checkup, we also look after the gynecological health of the girl, so that she is better equipped to handle problems later on. For example, anemia is so rampant, so to check it at an early stage, you can ensure that she doesn't have problems relating to anemia, worm infestation, then irregular periods affecting her health. So if they are corrected, it's much better for her. Polycystic ovaries that we have just talked about, for example, it can come to a young girl as early as say 16, 17. And if we do not pick it up and tell her about it and tell her about the diet, the weight loss and the medication that has to be given along with it, well, she'll be much better equipped to fight the problems. So our focus is basically on ensuring that women, that is the girl survives, right from the time is her birth to the time she is, you could say, becoming an adolescent and ready to face the world. So we are there at every step, whether it's and most of it is related a lot to the medical problems that she faces. So I think saving the girl is very important. The prime cause is that women don't come for checkup. It's not written on anyone's face that this lady will get cervical cancer and that lady will not get cervical cancer. There has to be 100% screening. Unfortunately, we don't have any programs where, you have to present yourself to a doctor. Like, you have some basic health checkups. Now, these are voluntary. It's not told to everyone that you must come for your annual pap smear, which is, quite effective in picking up early, very, very early cervical cancer changes. So women feel, oh, I don't have any problem, so why should I go to the gynecologist, They feel कि ये टेस्ट बहुत पेनफुल होगा, बहुत तकलीफ होगी, कौन जाएगा डॉक्टर के पास, अभी तो हमें कोई तकलीफ नहीं है. कैंसर जो अर्ली, अगर कैंसर हो गया और फिर आप डॉक्टर के पास जाएंगे तो जाना ही पड़ेगा ना. बट अगर कैंसर होने से पहले आप आएंगे और हमें पता चल जाएगा कि आप एक कैंडिडेट हैं जिसको कैंसर हो सकता है, तो आजकल बहुत अच्छे अच्छे ट्रीटमेंट्स हैं जो आसानी से किए जा सकते हैं, जिससे आप कैंसर अवॉइड कर सकते हैं. जिस दिन से कोई कैंसर के चेंजेस आ रहे हैं, वहां से लेके एक्चुअल कैंसर होने तक 10 साल का टाइम हमें मिलता है. सो वो 10 इयर्स में, फॉर एग्जाम्पल, अगर उसको इरोजन है, घाव है, वो एकदम से कैंसर नहीं बनेगा. इट टेक्स टाइम एंड द एवरेज इज अराउंड 7 to 10 years. उस 7 to 10 years में हम बहुत सारी चीजें कर सकते हैं, जो कि मेजर ऑपरेशन भी नहीं, माइनर ऑपरेशन भी कर सकते हैं, जिससे वो घाव हील किया जा सकता है. So all this can be done to prevent cancer. Unfortunately, the awareness is very poor. But one good positive thing I'm seeing nowadays is women are becoming more and more aware. We've held cervical cancer campaigns. We've held pap smear camps. We've called them. We've said, come and get yourself screened. So that has been bringing women out from their homes, कि ले चलो सस्ते में हो रहा है, let us go and get ourselves checked. So that is helping a lot. But every hospital, whether it's a government hospital or a private hospital, has this very simple test called a pap smear. And it's just so very unfortunate that women don't come. I think the reason is pure unawareness, and the ones who are educated, they are aware of it, but they are scared. So I just want to on this platform try to say that don't be scared. It's an absolutely painless test. I've had so many people who've done it and said acha ho gaya, they came with so much of fear and they said acha ho gaya, and then they are very relieved because they have come to know that everything's all right. So, like in the previous question, we just discussed about pap smear. Our expenditure on the healthcare is really dismal. There's no doubt about it. And any country's economic development will become much higher if we have a much more healthy population. So our healthcare programs, they're all there, but we don't have money to implement it. It's not the priority right now. This is what I get to feel as a private practitioner. For example, the pap smear campaign. Now, only if you have decided you want to get yourself examined, are you going to come? There are no incentives, there are no programs, there are no free pap smear, camps happening at a level where you would find all women wanting to opt for it. So, this very simple thing, as I said, targeted towards a preventable cancer like cervical cancer, that itself we don't, have. Oh, this is huge. I also read that write-up. It had come in the Tribune, and I was really shocked. I believe they just have a sugar cutting season between somewhere, and I read up about it. It was between October and March. So that period of time, they are really very busy, and the rest of the year they don't get any money. So it's basically economics. So supposing these contractors, they pick up these people as a couple to work on their fields for cutting, and it's a lot of hard work. So what happens is that they make some money, and if even 4 or 5 days of the month the lady is not able to attend to her work, then they cut that money. So just can't afford it because they've got to survive on that money. And unfortunately, there's a nexus, because one is the contractors insist that they work, they can't take any leave. Number two, you find that there are unscrupulous. I really hate to say this, but there must be unscrupulous doctors who are willing to do the hysterectomy. Like they'll just come and say, I have a lot of pain during my periods and I just can't, take it. Okay, fine, have it removed. So you have young women in their 20s who have undergone a hysterectomy. There are long-term implications. They have long-term implications on the health of that woman who's undergone a hysterectomy at a very early age. So it's not just a womb for bearing children. There are many other, problems that can be associated with removing the womb well before time. So these women are suffering, but then it's like a big circle. You can't even blame just the doctors who are undergoing it. Of course, from our part, we if we are there, we can refuse to do it. But they seem to think it's absolutely normal. So that is one of the things. So there's poverty. There is absolutely no guarantee that they will get any work. The loss of money as a result of not going to work because of the periods, which may be painful or they may be heavy, or whatever infections that they have, whatever other gynecological problems they have. So it's a combination of all that plus unscrupulous doctors who just at for any reason they go and do such a major surgery like a hysterectomy. So we have to break this. It has to come, it has to be legally brought in by the government. That's a very nice question. We face it every day. Dadi ma ke nuske, put haldi, milk, have kesar, you'll get a fair child, nariyal khao, gora bachcha ho jayega. Now, those may be like, just hilarious things. They don't really harm you. You have it. But sometimes things are. Like I had one person saying my baby is not moving that well. And she was told by the elderly women in the house that baby sleeps. So why are you all the time running to your doctor? Now that is wrong advice. There was a problem and she came quite late for a checkup and the baby was not moving, baby was no more. So it's a wrong thing. There are some practices which are good, which are okay, and there are some practices which are to be completely condemned. There's absolutely no scientific basis. So what I tell the patients is, whatever your dadi has told you or your nani has told you to do, cross-check with us. Just find out, and if it's not something which is going to harm you, it's fine. Like they may say, don't have papita. Well, that's correct. The raw papita is got papain and that can cause abortion. But by and large, other foodstuffs also they say don't have this, don't have brinjals, don't have chocolates. So those don't have any basis, things which don't have any scientific basis, and some of the things which have said still hold true. So we've got, what I tell them is, whatever they've told you, just listen to them, but come and clarify with us whether you can go ahead with it or whether you should be, not listening to that particular aspect. Become more active. As simple as that. Now, the simple thing that the thing you hear is, she's having such painful periods, I'm going to take छुट्टी today. आज मैं घर पे बैठी हूँ. What they will do is they'll pick up something, maybe a hot water bottle, and sit cramped like this and wait for the cramps to go away, which eventually do in 6 to 8 hours, and then they get up and have things. If they get up and perform simple basic stretches and bends, most of the time, and I'm saying most of the time, the what we call it in our medical parlance, we call it dysmenorrhea, that goes away. And what are those exercises? Very simple. You stand and you touch your toes. Okay? These are also there in yogasanas. खड़े होके पैर छूना है, बिल्कुल straight body करके. The other one is taking turns to your sides. That is, you put your hands up like this, of course standing straight, and then you straight and you take a curve here. That means this part gets stretched. Do this about 10 times. Do this about another 10 times. So all these, the blood supply increases, and the girl finds that her pain has become less. The point is getting up and doing this. Sign of having periods is that you're a healthy woman. So why have you to sit down and sit quietly for 2 to 3 days like that, feeling extremely miserable because you're having the pain? Get up and become more active. You're likely to have less of those cramps. Of course, despite these simple measures, if you're not getting any relief, we do give simple tablets, which maybe 1 or 2 can cover up that period of time, especially on the first day. But if in some cases the pains are, despite all these measures, are not getting relief, I would suggest that they must consult their gynecologist, because it just may be a sign of some of the other diseases which are very closely linked to painful periods. So these measures everyone can try,